Good afternoon, everyone. Welcome to the HMIS Non-HUD workflow. This webinar is intended for users that do not require to be compliant with HUD or ESG funding streams. So they're for agencies that have projects that only collect the universal data assessments. The objectives for today are logging in. We're going to show you the workspaces, the menu navigation, the workflows, the intake and the exit, the assessments. We'll touch on the services and the case notes. And at the end, we'll open it up for questions. Today, our presenter will be Miriam Dominguez from Kings United Way. I'm going to turn it over to her.
Hello, everybody. Okay, so as you see here, we're on client track right now. I'm going to go over all the new information for client track for the non-HUD workflow training. So as you see right now, I'm actually on the test site. You're going to want to make sure that you're on the right URL when you are logging into client track. So as a new user, you want to make sure that you are on www.clienttrack.net/ktcoc for the homeless website. And if you are a DV, you would make sure that you're on www.clienttrack.net/kuwdv. But for today, I'm going to be doing the training off of the test website. As I'm logging in, you're also going to see that there are going to be clients that are mock clients. They're not real clients, so all the information that is on this client track test site is fake. Just a second as I log in. Oh no. Okay, and as a new user for client track, when we do add you onto client track, we do ask that you sign an end user agreement. The reason we do this is because a lot of the information that is on client track is sensitive information pertaining to clients that you enroll. As you do log in, it's going to test or ask you to change your password. We will send you an email with all that information after you send in your end user agreement. So as you see right here in my work group, I'm logging on as non-HUD HMIS Programs 2017. From here, it's taking me onto client track. Mine defaulted to the home screen, so for today, I'm going to be acting as Kelly Clarkson, as you see here. You see the work group that I'm logged on under the organization, location. From here, as a new user, you also have the chance to change your photo. So you just click on it. You see that I selected this image for today. You can remove the photo, save a photo, change it at any point. Also, you can change your password from here. And also, I just wanted to let everybody know that when you do log on to client track, that I ask that when you are signing out, you sign out from here, because if you do just hit the X, it's going to be 15 minutes until you are logged out. So it's easier if we all just log out from the sign out on here. From here, I'm going to take you into the workspaces. Again, if you have any questions, make sure you add them into our chat so we can answer them at the end. Okay, as far as workspaces, you're going to click on the carousel, and here's our home. That's what we're under right now. You have our client section as well, and there's usually other ones, so this one says issues. Your home workspace is right here. You can see my name is Kelly Clarkson, my photo. It also is going to give you shortcuts, so this one takes you directly to the user dashboard. And if we click back to the carousel, you can also see that we have clients here. You can find a client. You can do the program intake as a shortcut automatically on here, a coordinated intake via SPIDAT, or also change a client's photo. So from here, we're just going to go into clients. I'm just going to show you really quick. So you can see that this is a fake client that I enrolled on here as a test. If you hover over here, it's a client ID number. You also have just standard information like birth date, exactly his gender, age, just all the information. So from here, we're just going to go back home. I'm going to show you our menu navigation. So from here, you can see that you can access your user dashboard. You have your standard reports right here. Clients and program, enrollment demographics, income at entry and exit. Also, you can see my client track, current enrollments, user configuration. And from here on HMIS reports, you can access any HMIS report that you need for your agency. Another thing that I wanted to go over as far as the menu, you can also search different information in here as far as clients. So I know one that I entered was, let's see, Craig Croc. So you can see that the client does come up if you enter it like that. And you don't have to put in the full name as well. You can just put in a client ID if you do have that on here. Another thing that you can do is look for, let's try assessments. No, that didn't work. Well, you usually can search other things on here pertaining to what you're looking for. You can also click between the menu or clients. I like using it to enter client ID number, but let's try Lily Lou. There's another client. It automatically comes up here instead of manually doing it the other way. Another thing I wanted to review as well is you can add favorites. So it will actually pin them directly onto up here on your menu navigation bar. Another thing too is, before I get into that, is if you don't want this to close, you can pin this directly onto your menu navigation. So no matter what you do, if you switch between clients, this won't close. So I'm gonna go back to the home screen. So you can see it still hasn't pinned, and then you can hide the menu again afterwards. So as far as adding a favorite, this actually saves time in case that you want to save a client specifically, or if you're doing specific assessments or intakes, or if you want to just make sure that you have something saved on here so you don't have to keep doing it over and over. You can change the label to, let's just do favorites. And it'll save it automatically over here as favorites. If you right click on it, you can also remove it, manage it. You can make subcategories underneath that one folder. It's called a new container. So I'm just going to close out of this. There's also properties, and I'm going to remove it from my menu bar. Again, if I'm going too fast or if you have any questions, please feel free to ask any questions in the chat bar, please. From here, I'm just going to go into workflows. Let me get out of this. I'm going to take you into a new client workflow. So we're going to do a program intake. So from here you can see that this is somebody else's information that I created earlier. But from here we're going to add a new client. Let's make somebody up. We'll do Lucy Lou. Then you're going to go down to the right and hit next. From there, you can see that when I did search and enter the new client, it does do kind of like its own search to make sure that you're not creating a duplicate client, or if someone else does have this name, it would kind of prompt you, showing you like, hey, there is another client with this name. But as you see here, there's nothing. So here's the first name, last name. The name quality, I'm putting it as full name reported. And also just to keep in mind, when you are entering a new client, I ask that possibly if you can collect the whole social. I know some clients are hesitant to give a full social to any of the caseworkers, but in order for it to look good on reports and stuff, or if we get audited, we ask that even if we have one number input, it would help a lot. But again, I know some of them don't, but if you could at least get one number, it would still work. So let's just do 628. So I'm just making a fake social right now. Then from here, you're going to go into basic client demographics. You can select a birth date either by entering it manually on here, or you can click the little calendar. This makes it go into previous years. So I'm just going to enter a fake birth date. So it automatically populates the age right here. I'm going to put full date of birth reported. As for ethnicity, I know that some people have issues, I guess, pertaining to how they exclaim that their ethnicity is. So I'm just going to put non-Hispanic Latino on here, but just keep in mind that some people do like to be referred to as Hispanic or Latino. From here, you're just going to select a race. I know sometimes clients don't know, but any information that they give you would help. So I'm just going to select white. A gender, for gender, something that changed or was just added in and it's going to be implemented is the trans female, male to female or male to female, trans male, female to male. Gender non-conforming, this is where they don't exclusively say that they're male or female. And of course, the other ones are still there, like client is a no, client refused, data not collected. I'm going to select female for my fake client. Oh, and as you can see, you can select multiple races as well. So pregnancy status, I'm just going to leave it blank. Veteran status, I'm going to say no. Another thing to keep in mind is sometimes when you're doing the intake on a form, some clients at the beginning say that they're veterans, and if you do later find out that they're not veterans, I just ask that you go back into the system and update it on this end. For family information, I'm going to list myself as self because it is the person that I'm making is their own themselves. So from here, just look over everything, make sure you've entered everything, especially with the asterisk, and we're going to click finish. From there, it's going to take you into family members. This is the client that I created as the self. You can actually use the scroll bar to scroll over. So if you're entering a family member, you would directly do it on here. You can select the little box right here, enter the family member's name, their date of birth, and just scroll down and make sure that you enter all their information. You have the Social Security information right here, which is something that we do need for additional family members, everything with the asterisk that you see. But for today, I'm not going to enter a family member. I'm just going to do it as myself. From there, you're just going to save and close. It's going to take you into program enrollment. It does let you select a different project type. For today, I'm going to choose, let's just do rapid rehousing. So as you can see that there is different projects for different agencies. Just make sure you select the accurate one. You can see my client information right here. So I'm going to select self. Here's myself. And here's my client. And you can see that the project start date is here. I know some project start dates vary according to when you intook the client. So you can actually change it on here as well. And from here, we're just going to click Save. And from here, here's the new assessment. This is a new universal data assessment. So you can change your assessment date on here. I'm just going to leave it as is. Here's my name right here. I'm pretending to be Kelly Clarkson for today. And we're going to look at disabling condition. I'm going to say that my client is not disabled. Also keep in mind that when we are referring to a disabling condition, we mean that this client's not going to be able to come back for that. So if it's like a broken leg for, let's say, 6 months, that is not a disabling condition. We need something that's like for life. That's what it means by disabling condition. We're going to select our type of residence. I know that some of them did change. One of the ones that did change, just the wording though, it's not anything new. So this one says rental by client with other housing subsidy, including rapid rehousing. That's new wording that was added. And the one that also changed was permanent housing, other than rapid rehousing for formerly homeless persons. Those are new ones that were added. It's just new verbiage for those. And all the other ones did remain the same. So I'm going to select place not meant for habitation. Now, when we go for length of stay in the prior living situation, I mean, it would just be whatever the client tells you. But if they don't know, try to give them an estimation because I know that helps a little bit. So for myself, I'm going to select that my client has been in that non-habitate place not meant for habitation for 90 days or more. And I know a lot of clients do have a hard time understanding when they went homeless, but one thing that I do tell some of the people who are doing the intake is to maybe guess like what time of the year it was. So I know that this is one issue that we have when I'm doing snapshot reports and approximate date homelessness, just if they can just give you a rough estimate. So I'm just going to say for my client, oops. I'm going to say that she went homeless on January 2nd of 2017. And as you can see here, it's underlined regardless of where they stayed last night, number of times the client has been on the streets. This means like prior to them going homeless, how many times prior they've gone homeless. So let's just say 2 times for my client. And then total number of months homeless on the streets, an emergency shelter in the past 3 years. I know some clients don't know and they can still give you a rough estimate. Something does help since it is asterisk. We do have to input something. So I'm just going to say total number of months homeless on the streets. We'll just say 6. And here for health insurance, it's a little drop-down menu. I'm going to select yes for my client. I know some people get Medicare and Medicaid confused. I'm going to select, I don't, I believe it's Medicare, the one that is for Med-Cal. So we're not going to select anything on this one. And then just make sure you review everything and that you select the appropriate healthcare for your client. So from here, we're going to hit save. Oops. And it does prompt you when you don't add any of the information somewhere. There's one role in the result that requires action. So I believe it's going to be this one. So just unclick it. And you see that I selected yes on here. We're going to hit save so we can continue on. And here the workflow is done for my client. So we're going to finish this off on here. So from here, you can also see that there's all my new client's information, her name, gender, her age, and you can see the program that I enrolled her into, the project start date. There's one case member and her assessment. So from here, you can see that you can go down the drop-down menus, edit enrollment workflow, add family member, view case members, update annual assessments, exit the enrollment, review entry assessment, and delete enrollment. So from here on, we're going to do exit the enrollment. And also, if I'm going too fast or if you have any questions, we're going to make sure that you add them into our chat box so Lucia can answer them as we go along. Oh yeah, and just to let you know, Med-Cal is medical, or what? Medicaid? So Medicaid is Med-Cal, I'm sorry about that. So I know that California just has a fancy word for it. So Medicaid is Med-Cal. I know a lot of people confuse the two, as I just did as well. So from here, we're going to do the exit date. You can either enter it manually or go into the little calendar and select the date. So I'm going to select my exit date. Destination. Here's all the different destinations of where they could have gone after exiting the program. So I'm going to do so I'm going to do rental by client, no ongoing housing subsidy. And there's exit reasons. You don't have to add them, but they are available there. It does show that I am the case manager assigned to this client. And case assignment. Also, my client has no recent income. So you're going to select, you can select your service status here as well. You can select the grant if you go down the scroll menu. And the enrollment shows here when I did it, Rapid Rehousing 9/29/2017. And if you scroll down, you can see everything that you can add to your exit enrollment. So here are all the services. You can use this box to select them all at the same time. You can go down one by one and make sure that you enter all the appropriate information for that. So from here, I'm going to save this. And so here is the client's housing status and other relevant information for health insurance as exiting my client. So I believe I said, I'm just going to say no this time. See how it blocks everything out so you don't select anything. Then we're going to hit save. And the workflow for exiting my client for Lucy Lou is completed. So you're just going to hit finish. Also, another thing that I forgot to cover is, well, I'll start doing a coordinated intake so I can show you. So for coordinated intake, we're going to add a new client on here. And pretty much for the coordinated intake, it's the same steps as a normal intake. So I'm not going to go through it, but it is the same format as the program intake. So I'm going to go on my carousel and just switch back to my client so I can show you guys something really quick. Well, let's exit this. We're going to cancel the workflow. Okay, so we're back to my client's dashboard. Another thing that I wanted to show you is you can actually add a client photo on here. This does help us, so in case we do find housing for a client, it helps other housing navigators in the area locate the client. I know that we have the client's name, but sometimes having a photo helps a lot. So if you can, we prefer that you do add a photo for your client. It's pretty simple. You just choose a file and save it. But I'm going to cancel mine. And also, if you're interested in to see who your client's case members are, if you hit this action bar right here and scroll down to view case members, you can see the case members right here. If they had family members or anything else, it would all be listed on here. You can actually edit the enrollment on here, exit enrollment, re-enter enrollment, and delete the person from here. You can add a new family, copy family. But if you guys have any questions with that or need further assistance, just let us know. We'll be able to help you. Okay, so from here, what I'm going to do is go into assessments. So I'm not sure if I'm doing this right. Looking for universal assessment. I think Lucia might have to help me a little bit with the assessments. Let me go back to my client. Oh, and I'm sorry about that. She's asking me to review entry and exit assessments. So on the action menu back on your client's tab on the carousel, you see that I'm on my client's dashboard. You're going to hit the action gear right here. Then you're going to go down to review entry assessment. So on here you can see that there are these little icons that you can click. So we're going to do universal data. So if you click on the little pencil, it'll take you straight to the universal data for this client. So we're going to do an entry for this. So universal data assessment information date. You can enter it manually, or again, you can click on the date inside the calendar. Excuse me. So we're going to say no disabling condition. You can see that the type of residence is place not meant for habitation, all the information that I already put into the system. Covered by health insurance, I did select yes. You can see everything that I went over here. And we're going to save it. You can see that you can select all the different assessments for the client, and also you can edit the assessment on here. So you can start the assessment on here, assessment date, assessment type. So we would click annual. When we do need assessments for clients, we ask that upon the enrollment date, if you are going to do an assessment for a client, it can only be 30 days after the enrollment date, or 30 days before for the annual assessment, because if it is like a day later, it doesn't link properly into client track. So we ask that you do it either before the 30-day annual assessment or from the client start date or after, but no more than 30 days. So I'm not going to change anything on here. You can add comments on here as well. I'm going to cancel this. And I'm going to go back to my client's dashboard. Another thing that you can do is exit, review the exit assessments. So here's, again, the little pencils that you can select on the assessment status, edit assessment. So it does say that it's finished here. I'm going to click on the little pencil. So you see here the master assessment active. You can change the assessment date on here. And you can manually enter the date here again, and as selected as a calendar in the calendar. So I'm going to hit no as I'm exiting and save it. Again, you can also hit this box in order to check all of them off. So I'm going to save this. And I'm going to go back into my client's dashboard. And then on here as well, we're going to end up going into services. So if you want to record services for any reason according to your program, you would just go into the menu navigation when you are on your clients tab, of course. Keep that in mind. Hover over services, go into quick services here. So on here, we are in quick services. You can select shelter services, transitional housing services, food pantry, anything that is according to your program. So we'll just leave it as direct services. Change the date, the grant type, the enrollment. And here's my name as I am performing this. And it also gives you the information on location. You can select this box again in order to select all of them. So if we do emergency shelter, you can do your unit type on here by count, enter the number of units, and it automatically populates it for you on here. So we're going to hit save on the bottom right. And then save and close, actually. I'm sorry about that. And another thing that you can do as well, if you go into the menu bar, we're going to go into case notes. I don't know, according to program type and your agency, I know some housing navigators and people who are doing intakes like to leave notes according to the client specifically. So on here, as you can see, there are no notes. If you do want to add a note, you can just click this add new case note. So on the case notes, you do see that there's the entry date, which is today. I'm the one that's entering the case note, and I could put regarding anything. It could be anything that you want to keep track of with the client. So I'll just say food. You can actually add a note type, disciplinary action, just a note, offsite appointments, anything that you would want to keep track of. And if you enter all your information on here, you can see that you can enter the client's note on here. You can also select services on here. I'm not going to put any. So you can even do case management on this enrollment. So all your notes would be right here. And from here, you would just save it. And some clients have multiple notes, and you can see them all in here as well. And if you wanted to print all the selection of notes, you would just select your document. So I'm going to click on here and print selected. Obviously, I only have one, but if you did have multiple, it would show up on here, and it's easy to print. So we're going to cancel this. Okay, guys, from here, I am leaving it up to questions. I don't know if there's anything else, Lucia, things that I need to review with you guys. If you do have any questions, make sure you enter them in the chat box so Lucia can review the questions or I can get back to you. Also, keep in mind that you guys are more than welcome to either email myself or Lucia, and you can also contact us here at the office at 559-584-1536 with any information, any questions, anything that you guys need help with, especially with snapshot reports. You guys are more than welcome to contact me on here. With anything pertaining to client track for assistance. So I know I finished a little bit early, so if you have any questions, just enter them in the chat box.
Miriam, we do have one question, if you don't mind.
Okay.
How do you run a report to show all the client information for a snapshot report?
Okay. So what I'm going to do, specifically to that client?
I'm not sure. I'm assuming that it's for a report to check on the deficiencies, I'm assuming, from the snapshot.
So we're going to go into our carousel. Make sure that you do go home. We're going to show the menu. And as you can see, you can access all your standard reports on here and also the HMIS reports. And they want to know where they're deficient in their program according to a client?
I believe so. I think I would run probably like the APR, the one you use to review data for the snapshots.
Okay.
I believe it's under the standard report.
I know, I'm like, did they move it?
Oh, maybe not. Go back to the HMIS report.
It's usually...
How about you run the data quality report?
This one?
Mm-hmm. And then maybe show how to export it. That way they can see the missing data.
Okay, so I'm just going to start over again. So you're going to go to, actually, let me go back. You're going to be on your home screen to access this. Make sure that you're not on your client's tab. You're going to go down into HMIS reports, HUD data quality report. You're going to click it. I don't have anything saved, so I try to ignore that. You can actually select your date range list. I'll just select this year. Begin date is January 1st, or you know what, let's do a month. Let's do last month. Begin date, end date is accurate. From here, you just select whatever organization that you're with and that you're running the report for. So I'm not sure if we have anything on here, but let's select Salvation Army. You can also filter by grant. So there's EDO, every door open, rapid rehousing. I'll select rapid rehousing. Your program type. I'm going to select, where is it? Page rapid rehousing. But there are, according to your programs, there are different types. Make sure that you do that. You can also filter by program again. I leave these blank. So from there we report. You can also schedule a report as well. Is this the right report, Lucia? I don't think so.
No, that's not the right report.
Maybe because it's on the test site?
Go back to your HMIS report. And the HUD HMIS report.
I'm not sure if it's coming up just because we are on the test site. Just keep that in mind, you guys. Everything's a little bit different on the regular website.
Okay, well, just for in order to show them, we jump over to standard reports and we'll run a clients and programs report.
Okay, so again, we are on our home tab. You're just going to go to standard reports, hover over, and you can see where it's clients in program. Oh no. So I'm just having a little bit of an error right now. I'm sorry about that. Let's try it again. There we go. So clients in program report. Again, I don't have any saved report settings. The preferred date range, I'm going to select previous month. You do see that the dates are selected. Again, you can click the calendar though if you want to select that. I'm going to select enroll at any point in the month of August. And then from here, you can select the agency that you're working with. I'm going to hit Salvation Army. Programs, let's filter by rapid rehousing. The grant type, there's none on that one, but you can filter throughout to make sure that you do get all the full report for yourself according to your agency. So now I'm just going to report, or you can even do a scheduled report. Since this is a test site, it doesn't show that I have any clients in any programs, obviously. Let me try really quick to do Kings United Way. Let's do...
Can you leave the programs unfiltered? That way it can pick up anyone from any program.
Okay, we'll do that.
Uncheck the
So we'll leave
program
this
box.
for organization. Oh, here we are.
You may even want to open it up to all organizations and check them all off.
All of them?
With the green arrow. Yeah.
So you see that I selected all of them just by clicking this green arrow right here. And we're not going to filter by program. And we're going to hit report. Okay, so from here you do see how many people were enrolled, exited. And if you hit this little plus sign, it will expand it as well. So you can see the names of the clients that you do have. There's only one for Barba Seville Shelter. And again, all this information is vague. This is just a test site. So from here, if you do want to expand whatever it is that report that you're running according to your organization for your clients, you would expand it on here just to see what clients that you do have. And if you did want to print it or export it, there's the little disc at the top with the arrow, and it has a drop-down menu, and when you click it, you can export it into a PDF. So you can also export the data into Excel. So you could have the raw data if you would want, but I'm going to export mine into a PDF. You can save it on here, save as, or you can just open it. So what I do is I just open it, and of course you wouldn't have all these other organizations. It would just be for your specific organization, and you can see the clients that you did enroll into your program, and you can easily print this. So I'm going to hit cancel. And that's it. Does anybody else have any other questions? Anything else that we need to review, Lucia?
I think that's it.
Okay, guys. No, thank you. If you have any other questions, I'll give you a minute or two to ask in the chat. Keep in mind that you can email us or call us at any point. And this is also being recorded, so if you would like a copy, just let us know. We'll send it right over to you. Thank you guys for joining our HMIS non-HUD program training.